Now we go to our reporter, Lora Windsor. She has the latest on a condition called rosacea.
Roger, rosacea is a chronic inflammatory skin condition that causes facial redness, and although the causes are unknown, treatments are available. We asked Dr. Timothy Jochen of Desert Regional Medical Center in Palm Springs what methods of treatment he recommends for the skin condition.
There are 4 types of rosacea. The first type is redness, dilated blood vessels, flushing, blushing. The second type is papular type, or bumps on the face that look similar to acne, but typically you don't have pustules that you see in acne. The third type is rhinophyma. That's where you see gentlemen that get these large Jimmy Durante type noses. And finally, you can get ocular rosacea, where you just get burning and stinging inside the eyes.
We asked Dr. Jochen what causes rosacea.
Rosacea is one of those mysteries. We still haven't solved that mystery, and we don't know what causes rosacea. There are lots of theories. We know what aggravates rosacea, but we don't know the root cause of it yet. It occurs in both men and women, and typically it occurs after the 30s. And so, and the extent of their rosacea really varies from person to person.
What can aggravate it?
Several things aggravate it. For example, we're really talking about the flushing, blushing. So things such as exercise, wind, sun exposure, alcohol, spicy foods, warm drinks, all those things can aggravate it and make you flush. So if you're going to a special event, you want to try to avoid some of the triggers that will make you red.
Dr. Jochen reviews the treatment options.
There are a lot of treatment options out there. It really depends on the type of rosacea you have. For example, if you have redness, you can try topical anti-inflammatories to cut down on inflammation and you avoid the triggers. But the best treatment is going to be to do some type of laser. With a laser, we can target the red and we can make that redness go away almost completely. So lasers are terrific now for treating the red type of rosacea. If you have the bumps that look like acne, we have oral antibiotics that we use. We also have different types of washes that are anti-inflammatory, and also creams that are antibiotics and anti-inflammatory. So it's just all about cutting down on inflammation. If you have the rhinophyma, the big enlarged nose, really the best treatment is going to be to do a laser procedure where we just basically shave down the nose with a laser. Some people will do loop cautery, but I haven't been really impressed with the results of that. Or you could just use a sharp blade and cut that excess tissue off the nose. And for ocular rosacea, still the gold standard is going to be to do oral antibiotics for that. Every once in a while, if somebody has really severe rosacea, sometimes I'll test to make sure they don't have some other disease going on, such as lupus or severe acne or something like that. But typically you can just look at it and see that they have rosacea.
I asked Dr. Jochen, is rosacea controllable?
I really feel like rosacea is very controllable. I've seen horrific cases where the whole face is red and it's all bumpy, and if you get them on the right combination of medications and laser therapy, I can get them cured almost 100% of the time. The only issue for people is that insurance companies do not pay for laser therapy, and that oftentimes is the most effective treatment, and if people don't have the money to pay for that, they're not going to get rid of the redness from the rosacea. However, if they do have the money to pay for the laser treatment, we can make them look great very easily, very easily.
If you experience persistent redness of the face, see your doctor or a dermatologist for a diagnosis and proper treatment. I'm Lora Windsor for the American Health Journal.